Welcome to Practice Pearls, Overcoming Therapeutic Inertia. I'm Dr. Neil Skolnick, Professor of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University. Therapeutic inertia is the failure to advance or to de-intensify treatment regimens when a patient's therapeutic goals are not being met. Overcoming therapeutic inertia requires utilizing many different strategies. One of these strategies, an incredibly important strategy, is what we'll briefly discuss today, and that is utilizing diabetes self-management, education, and support. And we are really fortunate to have Sasha Ullman joining us today. Sasha works for the Association of Diabetes Care and Education Specialists, where she actually oversees the accreditation process for diabetes self-management, education, and support nationally, as they are an accrediting organization for CMS. She leads over 800 programs nationally, serving over 200,000 individuals with diabetes every year. She also oversees the association's role with the CDC in the National Diabetes Prevention Program. Sasha, it is an absolute pleasure to have you joining us today.
Thank you for having me.
Let's start out by talking about those letters, DSMES. What do they mean? What do we do with it?
Exactly. So, I like to think in terms of DSMES stands for Diabetes Self-Management Education and Support, but what does that really mean? And really, people with diabetes are making upwards of 200 decisions every single day related to their diabetes. And we're not there to help them, coach them on these and on every decision. So DSMES is really there to help people figure out the best ways to make those decisions on their own. Things like, what do my lab results mean? What do I do when my blood sugar goes up? Why is my blood sugar going up while I'm sleeping? How do I remember to take that shot before I go to bed? When do I need to go see the doctor? Should I be calling the doctor at a particular time? And, it's evidence-based and covered by most Medicare providers. So really what we do is help train people how to self-manage their diabetes and navigate all those decisions that they're really making on their own throughout the day.
It's pretty amazing when you say 200 decisions a day. I've never quite thought about it that way, even as someone who takes care of a lot of people with diabetes. And when you said that, it makes me think about all the nodes that are available for essentially for therapeutic inertia, for doing nothing. When we need to make a decision, we often default to safety, which is not making a decision. Sasha, how effective is DSMES?
Well, DSMES is pretty darn effective. It's proven by evidence and research that it lowers A1C, reduces hospital admissions and readmissions and ER visits, and it's covered by most private payers and insurance companies, and not to mention there are no negative side effects.
How do you feel that diabetes self-management and education addresses specifically therapeutic inertia?
When you think of therapeutic inertia, you're thinking of people who are not getting maybe their medication isn't being adjusted as it should. And one of the main things we do is we do review what medications are with our participants and the medications that they're taking to understand how to take them, when to take them. And if they're not working, we've worked with them and realized this isn't working, really communicating back to their referring provider on, could we try something else? Even just thinking of an example, I worked with a lot of people taking insulin who would say, my doctor told me to take the insulin at bedtime. I'm doing it. I don't know why this isn't working. A diabetes care and education specialist, my first question is, well, what's bedtime? And often you hear, oh, it could be anywhere from 8 p.m. till 3 a.m. It depends on the day. There's your, thinking bedtime versus same time every day, both the right messages if you go to bed at the same time every day. But that's kind of the details that we kind of help figure out. We have time to unpack, how does your day look? When do you go to bed? What do you do before you go to bed? When do you get up in the morning? What do you eat? What's the first thing you grab? Do you get coffee? Maybe you put the medicine there. Really trying to think of practical ways for people to implement self-management skills into their daily routine.
And that level of detail is incredibly important. When you think about it, we as clinicians often think about diabetes from a distance. What is the medicine? What's the effect on A1C? But patients live their lives every day by the details of what they do. And I love the way that you explained that, unpacking the details. In addition to addressing therapeutic inertia and giving patients essentially empowerment to address things, and as well as information for their doctors, what are some of the other benefits of diabetes self-management and education?
Yeah, there's a lot. One of the things that I think we're most known for is improving people's confidence in self-management and feeling like they can self-manage. Diabetes can be a really daunting diagnosis and very frustrating. And as we work with our participants in DSMES, we're really helping them realize I can do this. Yes, it's hard, but once you have the skills and you understand how to do these things, it builds self-confidence and self-efficacy, which is key to self-management.
Yeah, I've been impressed when patients come back from having been enrolled, how much more enthused they are, how much more empowered they feel to take on their own disease. Because it is, I love the phrase you used, a daunting disease that is so life encompassing that it's incredibly helpful to have someone go over those details. You feel like you can handle it. Now, how do clinicians and patients find programs?
So, there's a couple different places on diabeteseducator.org. There's a link called Find a Program at the top of our website, and that lists all ADA and ADCES recognized programs and accredited programs across the country. And then both accrediting organizations also have links that direct you to their own programs. But I think the Find a Program link on diabeteseducator.org is your best place to find any program.
That's helpful. When should we think about referring patients?
That's a great question. There are really four critical times. And, anyone who's newly diagnosed should be offered a referral for DSMES and understand what they're going to get. And then also every year, this should be discussed with a participant. Every year, how are you doing with your diabetes? Would a referral help? And maybe offer that referral. It doesn't mean they all have to go, but offering it every year. And then when complicating factors arise, other diagnoses, different medications, changes in their diabetes management, other things that are kind of clinical, or when life circumstances change. That's kind of the fourth time is transitions in life and care. So when someone is going from when I think of some of these transitions, I work with teenagers who are heading off to college. Their whole life is changing. They're living with parents who are helping manage their food, and they move on to college where they're making all these decisions themselves. Or as a senior who loses a spouse, that's a big time when things change. I worked with a lot of seniors who lost a spouse who may have done a lot of the food preparation in the house. So navigating, how do I do this now? So any transitions in life and care is a good time to revisit a referral to DSMES.
Now, that seems nice in theory, but does insurance pay for that for all those times? That seems like a lot of potential times where patients may benefit, but does insurance pay?
Yeah. So in general, Medicare covers DSMES. Initially, the first time you utilize that benefit, you get 10 hours, but you have to use those 10 hours within a 12-month period. And if you don't use all 10 hours, you will lose it. But that doesn't mean you can't come back. Every year, you get 2 hours of DSMES, which can be done individually or in a group. And you also get 2 hours of medical nutrition therapy every year. So these are complementary benefits that can help a person with diabetes depending on what their needs are each year.
That's impressive. How about if a patient lives in an area where there isn't a DSMES provider? Any thoughts about how to handle that?
Yeah, there's one shining I think a silver lining to the cloud of the pandemic is that we're seeing more and more programs offer telehealth. And so even programs that are locally maybe a little too far for someone to drive to, may be offering telehealth that you can have access to. So during this time, it's really even looking at local programs and reaching out, even if they're not right in your community, they may be in your state or close to your community. So that's one option, is really reaching out to some of these programs. They may be offering telehealth now, and that is reimbursable. Another one is national programs who may not be in your community. We do have virtual programs that offer DSMES all over the country.
So, Sasha, those are incredibly helpful suggestions. If there was one take home message that you'd like to leave for our audience, what would that be?
You know, ask for DSMES if you're a person with diabetes. If you're a provider who needs the support to help your people with diabetes, champion it. If it's not in your area, that doesn't mean it can't be. Apply for accreditation, help get the staff on board. And if you have a program in your area, refer to them. And if there's questions about them, make that connection with the program, because they're interested in your feedback as a referring provider, as well as their participants' feedback.
Sasha, thank you so much for that overview. That was fantastic. It's a critically important topic for us and our patients to know about. For more information on overcoming therapeutic inertia, just put overcoming therapeutic inertia and the American Diabetes Association into your favorite search engine, and it'll take you to the American Diabetes Overcoming Therapeutic Inertia project, or you can go directly to therapeutikinertia.diabetes.org, where you can find in-depth webinars, podcasts, articles, and other resources on overcoming therapeutic inertia. For the American Diabetes Association, I'm Dr. Neil Skolnick. Thank you for joining us.